learned throughout the last couple of years is that we had, particularly in the US, a sort of kind of unprecedented interaction between the public and private sectors, and really opening new doors for true engagement and role for the private sector to step in. We have a long-standing history of great, fantastic innovation coming out of the private sector, but I think some of the things that we learned here were the regulatory changes that needed to happen to facilitate innovation moving more quickly, and really, the advent of a vaccine with it for, against this global pandemic, against COVID-19 in about a year's time is really quite remarkable. And it showcased both the power and the incredible kind of intellectual wheelhouse or the intellectual capacity that existed there in the biomedical sciences to be able to pivot that and apply it toward this new pandemic, this new virus, was quite remarkable. But that took a lot of innovation and a lot of dedication from the private sector to make that happen. And it took engagement with the public sector to try to facilitate those processes and open up new regulatory pathways. And I think the goal here is to think about, it was very acute in all of our lives, this pandemic, this virus, but we are afflicted by chronic disease and by many other conditions. And what we're trying to do now is build on the lessons learned to figure out how we can accelerate the innovation and the dissemination of what we know and the therapeutics that exist and that need to exist in the future to target many more diseases.